Okay, so it's just turned 12:30, so I think I will make a start if that's all okay with you all. So first of all, hello, welcome everyone. My name is Charmaine Jackson and I head up the training team for Ardens. And for today's webinar, we're going to be looking at the Ardens vaccination solution and very much focusing on COVID-19 and RSV and showing you the resources that we've updated to help you in that area. Now, this webinar is only for EMIS practices. So if you are a System 1 practice, unfortunately, this is not going to be very helpful for you. But we did do the webinar just yesterday. So what we will do is I'll get my colleagues to share the recording for you in the Q&A, just in case you have joined the wrong one today. If you were around for our LTC webinar yesterday, welcome back again for another one. Hopefully you'll find this one valuable too. And I will be talking about training and support that you can tap into near the end of the session, should you wish to have more training after this webinar today. Now, just in terms of housekeeping, just to make sure you're all happy with the setup, and hopefully a lot of you have joined our webinars before, but just in case, your microphone is disabled and it will remain that way all throughout the webinar today. If you do have any questions that you would like to answer, then please use the Q&A section, and I have a team of colleagues who are ready and waiting to take your questions today. So just to quickly introduce you to my colleagues, so we've got Chris, who is one of our training specialists, who also joined us on our webinar yesterday. So welcome back, Chris. We also have James, who is our head of development and is very much involved in all of the resources that are being updated that we are showing you today. And we also have Tudor, who is a GP, a working GP, but is also working for our clinical team. So again, Tudor's available if you have any clinical questions throughout this webinar today. The session will probably last an hour, if I'm honest. So I'll try and stick to that time as much as possible, and it will be recorded. So the recording will go out to everyone that has attended today, and it will be put on our website. And I will get the team to just quickly pop on the Q&A right now how you can access our recorded webinars. So you've got that just in case you need to leave a bit earlier. So in terms of what we're going to be covering today, I'm first of all going to give you a very quick summary of what the vaccination schedules are for both RSV and for COVID. We're then going to talk about the solutions, so what we're here to help you with. We're then going to do a live demonstration, so I'm going to walk you through the resources to make sure that you're comfortable with how to use it. I'm then going to talk about the next steps that you can take, and we're going to then look at ongoing training and support, which is on offer for you all. Remember, anything to do with training and support, because you're an Ardens customer, it's absolutely free, so you can have as much training as you like. So in terms of the schedule, and I mean, you probably know this already, but just as a reminder then, starting with RSV, there has been some changes from the 1st of April this year. So there's now no upper age limit. So if you remember previously, it was your 75 up to about 79, and then they said that you could do your 80-year-olds. Well, they've taken that cap off now for your 80-year-olds. It's just basically anyone over the age of 75. So that's change number one for RSV. They've also introduced you to be able to vaccinate your patients in a care home for older adults. So that's new now, that you can do that. Very similar to your COVID requirements as well. And your pregnant women remain the same. So you can vaccinate your pregnant women from 28 weeks. And remembering that each time the patient falls pregnant, they're then offered a RSV vaccination. For your patients who are aged over 75 and for your patients who are living in a care home, that's just one dose that they require. But for your pregnant patients, it's every time that they do fall pregnant. And you would have remembered the update that happened just recently that says now that when you vaccinate the patient, the day that you record that vaccination, you also have to confirm their pregnancy and add that pregnancy code in too. So that was a change that happened not so long ago, but I will show you how we can support you with that. Now, in terms of the COVID-19, no massive changes, but we're just moving to the spring season now. So it's the spring boosters now that we are focusing on from Monday onwards, so from the 13th of April. So that's still your age 75 and over, including those patients who will be turning 75 by the 30th of June 2026. It's still including your care homes, and it's still including your immunosuppressed patients as well. So that's the same cohort. It's also worth noting, again, something you probably already know, that you can give RSV and COVID-19 at the same time. So that's really useful for your patients who are age 75 and over, because that's for both groups, and also your residents in a care home for older adults. You're looking at giving vaccinations for both of those groups as well. So hopefully that makes sense and is what you are aware of what those updates are too. So really moving on to the solution then. So we are trying to help you with the whole vaccination journey for RSV, for COVID, not just those areas, but every single vaccinations from flu, pneumococcal, you name it, we have vaccination resources to help you with everything. And what we're trying to do is, like I mentioned, we're trying to help you with every part of that journey. So we want to help you with the plan side so that you can have an estimate of how many vaccinations that you will be delivering over that time frame. We want to let you know who is still due so you can keep on track on what's still outstanding. We also want to help you with inviting your patients in for the vaccine, identifying which patients need to be invited quickly and easy within your system. We want to help you with the administer stage. So now the patients now come in, what's a quick, easy way that you can vaccinate these patients and get that recorded on the system? And then we want to help you with insights too, so that you can see your activity, not just at your practice level, but also PCN and ICB level too. So a lot of what I'm going to be demonstrating today will be mainly in your clinical system. We have provided EMIS practices with a brand new Ardens vaccination template, which I'll show you today. Also provided you with protocols and reports that we're going to look into. And I am going to mention Ardens Manager at the end because that's really useful to help you monitor your activity. So if you do have any questions that you would like to answer us, then please do make sure that you're using that Q&A, and I'll check in with the guys every so often. Now, I'm not going to do death by PowerPoint, don't worry. I am going to share these slides though, because this gives you an idea of the different resources that are available for each stage. So if you do want a quick reference, then you've got that information available for you. So what I'm going to do now is I'm going to jump into my EMIS system. Now note that the EMIS system that I'm using is a test environment. So any patients that you see on screen will not be real patient information, but the way that I use it will be the exact same way that you will use it back in your EMIS system. And I'm going to start with RSV, and then I'm going to move to COVID. So if we look back at that journey where we looked at plan, we looked at notify, I'm going to start with the plan stage for RSV first. And when you're doing the plan stage, you're very much going to be using the reports that are available for you. So I'm going to go into population reporting. And within population reporting, the folder that you're probably very quite used to now is the Ardens searches folder. So that's where you'll find our reports for these particular vaccinations. Everything is categorized. So I'm moving down to the vaccination area, and COVID you'll see here, which we'll dip into in a minute, and RSV you will find here. So the current version that we're currently on is version 2.3. Now, if you are following along and you're looking at your EMIS system right now, and you're looking at this version number and it's completely different to mine, then please note that you will be updated as part of your next routine schedule. So you get updated every 3 weeks, every practice does. But if you want to be looking at the very latest one now, then you can be downloading this folder, this report folder from the portal. And I will get my colleagues to post the link on how you can download it from the portal so you can go and do that straight away. The main difference that you'll see in the version 2.3 and also version 2.2 is just a new structure layout. So it really labels now what's for planning, what's for notifying, what's for reviewing. So please go ahead and download that if you want that structure straight away. Now, starting with the plan stage then, so this is all about looking ahead, looking at what my vaccination delivery would be like for that particular period of time. And then that's then helping me understand the workforce that I need to have in place and whether or not I've got the right clinics in place to be able to help me deliver this RSV vaccination program. So this is what these folders are doing. You might find that your management team would dip into this a lot, but you'll also find that your admin team would be using these folders, particularly for housekeeping reasons. And I will tell you what I mean by that in a minute. So starting from the top then, and having a look at the cohorts folder. So this is really just telling you what your total eligible cohort is. It's not taking into account those patients that have been vaccinated or not. It's not doing that at all. It's just saying that for RSV, at this moment in time, these are the number of patients that are eligible to have that vaccination. So this is information only report and really useful to help you with your planning ahead more than anything. So I can see here at the very top, that's given me the total number of patients that I would need to vaccinate. I bet you wish yours was 19. It probably isn't. It's probably a lot higher. But that is telling me the numbers that I would need to be doing. What it's then doing, it's breaking it down for me. So out of those 19, 7 of those patients are currently pregnant at the moment, and the rest of them, so I've got 7 who's over 75, and the rest are in care homes, sorry. So I can then do that breakdown if I need to. Moving down, and just to run that folder, it's just a case of right-click and run. So this is no different to how you're using your EMIS reports already. And remember, anytime I run a search and it provides me with a result, if I want to see who those patients are, I just go down to my population included tab, and there's my patients. But strongly stress at this point, do not use these reports here for inviting. You've got further reports to allow you to do that. Moving down then, you've got your due reports. So this is now taking into consideration those patients who have or have not had the RSV vaccination. So this is telling you what work you still have left to do. Again, it's broken it down by the different cohorts for me, so I can see maybe which area I need to be doing more work on. It might mean that I want to prioritize these patients in any way. So therefore, again, it's given me a number, but it's just information only. We're still not using these reports to invite. It's just giving me some insights on what is still outstanding for my practice. So I hope that makes sense so far. Now, the review before folder is where you'll do a bit of housekeeping before you start inviting your patients in. And I recommend that you always look at this folder before you start sending those invites. And this is just flagging up potential data quality, potential patients that you need to be reviewing. The very top report here is answering you whether or not these patients are still actually pregnant. Because remember, when it comes to inviting your pregnant patients in, it's looking for a pregnancy code, a latest pregnancy code. And there may be some occasions where you may have put the pregnancy code in, but you have staff that have not put the delivery outcome code in. So therefore, those patients are still showing up as pregnant. We see it all the time when we go out and do training. So this really is for you to be able to look through that list and decide whether or not it is the case that the patient is still pregnant. If they are, fine, don't do anything with it at all. If you know that they have had a delivery outcome that hasn't been coded, then you would go into their record and make sure that you record that activity. Again, I would just make sure that I run the report, and then the patients would be in population included, allowing me then to go in and check those records for the patient. This one here is just highlighting the fact that the patient has had their RSV vaccination, but the pregnancy code is gone in after that RSV vaccination. Remember, it has to be on the same day. So you need to put that RSV vaccination in, and you have to confirm that pregnancy. So it's just telling you that potentially there may be impact in payment there because it's the wrong way round. So again, you would go into each of those records, and hopefully you don't have many, well, hopefully you don't have no numbers at all, but hopefully not many. You would go into there and you would then correct that so that it is showing correctly. So that's your plan folder. Hopefully that's quite straightforward. Give us the thumbs up if you feel that's okay. But this is mainly for information only, these first 2 folders. Thank you very much. So information only for these first 2 folders. It's the third one here, which is the housekeeping. So you will need to just make sure that you assign an admin person to make sure that they're looking at this every so often to make sure that these patients are being dealt with. Okay. So that's your plan stage, nice and straightforward. You now then move on to your notify stage. So this is where your admin team will be inviting patients in for their RSV vaccination. What this is doing is splitting out your patients who require a visit. So this is mainly your care home and your housebound, because you may want to deal with those patients differently. We'll look at that in a minute. Here's your invite folder. So within the invite folder, it's broken down by pregnancy and routine, in case you want to prioritize those patients in any way. I'm going to stick with routine for now, but the same applies for your pregnancy patients too. So I'll go ahead, right click, run that, and that will then just find me all patients who have not been vaccinated yet. At the very top, these patients for first invite have never had an invitation for this just yet. So therefore they need that first invite to be sent to them. I've got 1 patient who's due here. So what I can then do is make sure that this report is highlighted. And then I'm going to click on view results. And that's going to provide me with details of who the patient is. It's also going to tell me what their contact details are. So their home, mobile telephone number, email address. It will also let me know if there are any reasonable adjustments at all, any communication requirements I need to be aware of, any preferred method of communication. Is the patient on a learning disability, dementia or SMI register or mental health register where I may want to prioritise those patients in any way? So that will hopefully give you all of the information that you need to be able to prioritise and then to be able to bulk message those patients, inviting them in for their vaccination. So if I do want to export this report out to do those things, I hit the export button and I'm exporting it as a CSV file. Tick the first box, third and fourth box, and then click on OK. Please don't worry, we've got instructions on how you can do this so that you've got that to refer back to. What that will then do is export a CSV file for me so that I can then import that to my relevant third-party messaging system, whoever I use currently in my practice. So I've now invited all of my patients in for their vaccination. I have to also code the fact that I've done that, and you'll be used to this process already. If my process in practice is now to batch add the code to all of those patients that I've now invited, then you've got the search up the top here to be able to click the batch add option, and then you want to batch add a clinical code. When you click on the clinical code option, you then want to complete the information here. So the batch add option is where you pop the code in. I believe there's only 2 invitation codes that you can use for RSV, and I think both of those should hopefully be on our support article. So I will make sure that Chris has shared our support article for you so that you know exactly what those codes are. But you probably would have been invited in already, so you're probably aware of them now. So I'd add the RSV invitation code in here. I would pop in a description. Maybe I'm just going to say for first invite RSV, for instance. And then I need to specify what report I want to batch code that code on all of those patients. So really all you're doing is navigating back to this search here. Let me show you how to do that just in case you haven't done it before. So you would click on the magnifying glass. You would go to Ardens searches. You would then navigate down to vaccinations RSV. You would then click on notify, invites, routine for first invite, and OK. And that will then pop that population in here. It will tell me how many patients it will impact. So that should be the same number as what I've just run here. And then I can click on OK because I want that to happen immediately. And then in the background, it will start applying that code to all of the patients that fall within that search. So hopefully that makes sense. I run my report to see how many patients I need to send the first invite to. I then select the report and click on View Results to then be able to export it as a CSV. Once I've done that, I then come back to this search here and I'll use my batch add option to batch add the clinical code onto each of the patient's records. So that's sending my first invitation. Now, the patient's now received their first invitation. If they've not responded within 2 weeks, so if there's no signs that they've had that vaccination done, then the patient will move down for a second reminder. And the process is the exact same as you would do for your first invite. The patient's now received their second invite. They've still not responded. After 2 weeks, the patient will drop down to their third invite. Again, no response. So anyone else that's still not responded to 3 invites, they will drop down to the very bottom one so that you can do some mop-ups and chasing of those patients if that's the process that you follow within your practice. So that's now all of my routine patients invited. I've also done some reminders as well to make sure that I'm picking up patients as and when. I can move to my pregnancy, and that's the exact same thing as well. But the only difference is these patients have been coded with a pregnancy code and they haven't got a latest delivery code in, so they're definitely pregnant. And then from here, again, I can invite my patients in accordingly. For your visits, really straightforward. These are a list of all of my care home residents. We've also broken down by care home residents who are also housebound and care home residents who are not housebound, in case you want to prioritise or maybe give those to different staff members within your practice. And then we've just got housebound patients who are not a care home resident. So I always say, when it comes to doing any sort of batch inviting for vaccinations, do make sure someone's doing some tidying up in the background, making sure that these patients are definitely still housebound, making sure that these patients are definitely still in a care home. And we've got searches in our admin folders just up here. So if you go up here in these folders here, I think it's on registration, you'll be able to see that there are care home coding searches to be able to support you of making sure that that housekeeping work has been done. So it might be one worth noting there. So that's my notify stage done. Patient has now received their notification. They're now coming in for their RSV vaccination. And this is where we come away from the reports now and we go into the patient's record. And I'm going to show you what your healthcare or your nurses or whoever does the vaccinations within your practice, I'm now going to show you what they need to do. So there's actually two ways that they can do this now, because one way it might mean that they're seeing a patient on an ad hoc basis and they want to just quickly record the fact that they've given an RSV vaccine. You can do that nicely through our template. The other way is that they're doing a clinic, a vaccination clinic, and they're seeing patients in bulk, and they want a quicker way of being able to do that rather than opening up the template. And that's when they can use our protocol. So I'm going to show you both ways. I'm going to start with the template first. So if they want to use our template to record these details, they press F12 on their keyboard. When you press F12, what they want to launch is the vaccination launcher. So every single person will need to add that to their F12 key. I'm thinking of yesterday's webinar. James and Chris, if you can just pop in the name of that launcher, that would be great, so that people know which ones their clinicians need to be adding. So if they add a vaccination launcher on their F12, each individual person will need to do that. So they will need to right click, go to add and search for this launcher here. And when they double click on it, it gives them a quick, easy way to access not just our adult template, but also our child vaccination template as well. Bravery certificates are there too. So it's a really good one to have on their F12 key. I want the adult template. So I'm going to hit adult. And what that will then do is it will launch the template. There we go. And very first page, your home page, gives you a good summary of the last time, if they have had it, had any of the vaccinations. So I can see at a quick glance the last time they had their flu, the last time they had their RSV, their pneumococcal. It just saves me having to go all the way through the patient record. I can see what their vaccination summary is like from that very, very first page. On the left-hand side then, this is where you have the different vaccinations. And I'm going to go to the RSV page because I'm delivering an RSV vaccination. And this will give me all of the information that I need to be completing for that vaccine. So I can say here, my patient is 75. They require an RSV vaccination because they're age 75 or over. If the patient is pregnant, or I can tick whether they're in a care home as well. If the patient is pregnant, I can tick to say that I'm doing this because they are pregnant. And I'm also going to tick the pregnancy code, confirming that that patient is pregnant too. So this is where we're supporting you to make sure you put not just the procedure code in, but also that pregnancy code as well. But my patient's just over 75 for now. Just below that then, I've got all of my consent. So this is them consenting to the procedure. So I can tick the box here to say that they've consented and that they're actually fit for the immunisation as well. And I've also given them advice around the signs and symptoms for the RSV vaccination that I'm delivering. When it's then time to say that I've done it, I can click administration of RSV vaccine. And again, you're used to this. This is nothing new. You've probably seen this in most EMIS templates. But from here, for this patient, I can add the manufacturer details, the expiry date, the batch number, and whether or not I've done it in the left or right arm. So I've got all of the details to be able to complete that information. If I need to say that I'm doing this under either a PGD or PSD, then I've got the option to be able to tick that. You do need to make sure that you're following your practice process here, but what you're doing here is just simply ticking the fact that it has been administered under PSD. On the left-hand side, we've also got the PSD's page. So if I want to go further into saying that authorization has been given, I can tick the box here, and then this is pre-populating the text for me. So I've got that option there if I need to do that. And once I've completed all of that information and I'm happy, I can save it, and then that will save it all back into the consultation for me. So that's one way to do it, and probably recommend that you do it this way, mainly if you are doing it on an ad hoc basis for the patient. Now, you will see this box come up. This is nothing to do with Ardens, so I want to stress that. This is an opt-in or an EMIS alert, because it's now very important that not only do you record the procedure, which is what we're helping you with, you also have to record the product. And in easy terms, that just basically means it's the medication issue, the scripts that you now need to make sure that you're producing as well. So opt-in will help you with that side of things. We're just simply helping you with recording the actual procedure code itself. So from here, you're following the opt-in alert, and you would go ahead, and if this is how you do it in your practice, you would go ahead and you record the information. I'm just going to exit it for now, because like I mentioned, our part here is done where we're helping you with that procedure code. Hopefully that makes sense, but that's how you would do it using the template. Now, if you want to then use the protocol, which is a really good way if you're in clinic and you want to be able to just fire out these patients have had their vaccines really quickly, then this is where you can use the protocol. And I'm hoping EMIS doesn't want to crash on me right now. It looks like it is. Just bear with me a second. Chris, I might need you to have yours. Oh, no, it's okay. I don't need to. Okay, there we go.
I will keep it open just in case,
Charmaine. Thank you very much. Thank you. So using the protocol then, if you are using the protocol, it's another F12 key. So you press your F12 key, and this is the protocol that you need for RSV. So it's the RSV Vaccination Administration Protocol. So your staff member would double click on that, and what that would then do is it would take them through a series of prompts. It will open up a consultation, and then it will take them through a series of prompts to record the information. So you're probably very used to using this with flu and probably a lot of things that you're doing around vaccinations, but we provided you with one for RSV. We've now also provided you with one for COVID as well. So my patient is medically fit, they've consented, and I'm giving this to my patient who's aged over 75. But I've also got the option for pregnant, and I can say whether it's been done under PGD or PSD. I can also say if the patient's contraindicated or declined. So I'm going to click the option for over 75. I'm then picking whether or not I've done this in the left arm or the right arm. Now, this is really, really important to note, because you notice here I've got a load of X's here. So in order to use this protocol, someone in your practice has to edit the protocol to include your batch numbers, to include your manufacturer details, etc. And at the very end of the session, I will show you how you can edit your protocol, but this has to be done in order to use this. So let's just assume that that protocol has been edited by someone in the practice. Now I'm just making sure I'm picking the right batch number, because I could have several that I'm delivering. I'm going to pick left arm for now. And what that will then do in the background is you'll start to see it recording all of the details in the background for me, so the procedure code. This then, remember, is an EMIS alert, because it's now advising me to enter the product code. I really hope that makes sense. So this is what we're helping you with. EMIS is now allowing you to put that script in. So that's how you record for RSV. So you're either going to be using our template or you're either going to be using our protocol. If you're using our protocol, you have to make sure you edit, and I will show you how to do that at the end of the session. And really, just to go back to the reports now, if we've got, after the fact that the vaccinations have been done, we've got the review folder, which is just watching out for any data quality issues. So this is just saying that these patients are pregnant, but they haven't had the pregnancy code added on the same day as the vaccination in the last month. So therefore, go through the record and make sure that the coding is on the same day. Remember, you can click on population included, and that will tell you who your patients are. You've also got the evaluate folder, which is basically just summarizing all of what you have administered, whether you've done it here or not, how many you've done in the last month, how many you've done in the last 12 months, and how many patients are contraindicated or declined. So that kind of gives you your activity there. So that's the RSV side. I am just going to stop just to see whether there's been any questions around that. Anything, James or Chris, that you want to add at this point, let me know.
For anyone trying to add the RSV protocol to the F12 now, we're currently waiting for a resource publisher to do a refresh. So if you try and do that first thing in the morning, it'll work absolutely fine. There was a final update that needed to be made just so everything was working well for this session.
Thanks, James. And any questions on the chat we need to talk about, or was it mainly around that? Or Chris, either of you.
Just general questions, really. Okay. There's one about, can HCAs give RSV vaccinations? I know there was a query on Facebook about they can't give COVID, I don't think. I don't know whether James, do you know, or Tudor, do you know more about that?
So with the changes to vaccinations, it has to be a prescriber who does the consent for vaccination now. So that is getting informed consent from the patient about what the vaccination is going to do. That prescriber can then issue a PSD, which would allow a HCA to give an RSV vaccination. For COVID, there's the new VGD, so the vaccine group direction that's come out. That can be signed by a registered healthcare professional, such as a nurse, and that would then allow them to consent patients for COVID. And then you can have other healthcare professionals or HCAs also sign that document, which would then allow the initial signer to supervise HCAs administering COVID.
Thanks, James. Thank you. I'm just looking through some of the questions, and don't worry, I'm not going to make my 75-year-old patient pregnant. It's just for test purposes only, but you know where to find the different fields and things in the template, so hopefully that's been helpful. So putting RSV to one side now I'm going to look at COVID. So notice that we're not doing joint searches here. We have separated, so one for RSV and one for COVID, because practices work so differently as well. So we thought it's much easier just to give you the individual vaccination suites. So I'm now going to be focusing on COVID. So I'm going to move down to, or move up even to 3.11 vaccinations, COVID spring 26. So we're currently on version 1.1. And within this folder here, so again, you can download this from the portal if you're not seeing the very latest one. If not, don't do anything and don't worry, because we will be updating you in your next routine update. So now that I've explained RSV, now looking at COVID, or actually majority of our vaccination suites now should be really simple and easy to use because they all follow the same structure. So for my COVID spring boosters, I've got my plan folder up the top here. And again, it's got my cohorts here so that I can estimate the number of vaccinations that I'm going to need to do for the spring boosters. Again, we're breaking it down by those eligible groups as well. What we've done differently though for COVID, the only thing is broken it down by groups. So we're also letting you know Islam seekers, ethnic minority, homeless patients, housebound, learning disability, pregnant, and SMI. So if you do again need to prioritize these patients in any way, then we have got the options for you to be able to do that. So this is just looking at estimation. Your due reports, again, remember this is telling you how many patients have actually had their vaccinations or not. So this is telling me who is still outstanding from the 13th of April. Remember, we can't do anything until Monday. So this is telling me who is still outstanding from the 13th of April. And again, breaking it down by those groups too. We're also letting you know what that looks like for your housebound, LD, pregnant, etc. Your review before, again, is housekeeping. Make sure that you're doing all of that before you are inviting, to make sure that you've got the right patients on your list. So here we're telling you, for instance, consider the coding. So consider adverse reaction code. Also look at reviewing the status, because these patients still have an allergy in their record. Is that still the case? These patients are still a care home resident. Is that still the case? As well as housebound, etc. Just to make sure that our lists are correct. And Again, once we run them, we go to population included, and that will find me my patients that I can then work my list on. So sorry, there are reports there. So I'll go to view results, and that will then show me who my patients are, and it will tell me what my latest codes are. So that's my planning stage. My notify stage works the same for RSV as well. So I've broken it down by invites, and I've got my visits there. So for my invites, these are all of my patients who require a first invitation, and we're reminding you to remember to add the invite code, and this is the search that you need to add the invite code to. I am going to get my colleagues to share the COVID support article, because that includes all of the different invitation codes that you can be using for COVID, as well as how you actually use these resources. If the patient doesn't respond to their first invite, they drop down to the second. If they, after 2 weeks, and after 2 weeks, they drop down to the third. So same process as your RSV. Remember, if you want to export the report out to be able to message your patients, then once the report has been run, you click on the view results option, and you can then export that out as a CSV file. Your visits work the same too. I've got my list of patients to invite in, however is best for my practice. So when it comes to actually administering and recording the fact that you've administered the vaccination, no surprise, it works in the exact same way that it works also for RSV. So I can use the template if I want to. So back on my F12, I'm going to hit vaccinations launcher, back into my adult template. And this time, when it loads, I have my COVID page just at the top there. So this is what's new with this adult vaccination templates. We never used to have the seasonal pages added. So just make sure you're definitely using the adult vaccination Ardens new template, not the previous immunization template that we had available. But if you go through your protocol and your vaccination launcher, you will be opening up the right template. So here we go. Again, we've got the options up the top to say that the patient requires a COVID vaccination, that they're fit for the immunization, that they consent for it. And this is my option here to do an ad hoc administration, adding that procedure code. Slightly different here, and you hopefully would have been aware of changes just recently, that PGD is now being replaced by VGD. So therefore, we've got the tick box to help you say that it's been administered under VGD. What I will do is I'll get my colleagues to pop a link in the Q&A on more information around that in case you haven't heard about it yet. But it's important that you know about it, but it's also important to know that on the template, we do support you with that as well. So you've got your VGD, you've also got your PSD, and you can use the PSDs page if you need to as well. You've got the text box there to be able to record any additional information. Save it, and that's my procedure code saved in the patient's record. Now, what's new for COVID and the resources that we provide for you is we've now provided you with a protocol for COVID, which again works the same as the RSV, works the same as flu, but you have to make sure you edit it first to include your batch numbers, manufacturer details, etc. From a front end, so any clinicians that are using this, they press F12 on their keyboard, and the one that you want them to add this time for COVID is seasonal vaccinations COVID-19. Chris, if you can just put that in the Q&A to remind people. So each person will need to do a right click, add, and what they're adding is the seasonal vaccinations COVID-19 protocol. Double click the protocol and works very similar. So I can say that this patient has recorded their consent and they're fit and well. I can also record the patient's age, so I'm doing this for someone who's over the 18, and then what type of COVID vaccination am I giving for that patient, so I'd pick the relevant option. I would then say whether it's going in the left arm or the right arm, but remember this has to be edited to include all of your batch numbers and expiry dates, so your clinical team know exactly which ones they need to select. And if you're doing any clinics from Monday, you'll need to do this quite soon. The protocol is available for you right now to be able to do that bit of work. So select the details, and at this stage, This is the Ardens protocol now done. So we've helped you complete the procedure code. This option here is now the opt-in or EMIS protocol that is now firing off. So this is where you are adding the actual medication script in the records. I'm just going to exit that for now. With the COVID one, we've also given you the option to link in your RSV. So what it's now saying is now you've just done COVID for that patient. Do you want to now administer RSV? So if you're doing it in the same sitting, then you click yes there. And what that will then do is it will fire up your RSV protocol and it will allow you to run through that process rather than you having to go back into your F12 each time to be able to do that. So that's quite handy if you're doing it, both of them at the same time for the patient. And then just going back to the reports, and then what I will then do is I will finish off with how you can edit the protocol. So just going back into the reports now, it's just to mention that we have got that evaluate stage. So here again, it's telling you the number of patients that you have administered COVID to, broken down by the different groups as well. And you've also got your invite searches as well. So how many patients have been sent a first, second, and a third invite. So I'm just going to pause there. I'm going to see whether there's any more questions that need answering in the group before I start showing you how you can edit protocols. So please do answer your questions if there's anything that's not making sense so far.
Charmaine, quite a few people are saying they can't find the seasonal COVID vaccination protocol on their F12 key. I have posted that if they refresh, it should be there.
Correct.
But sometimes a refresh does take overnight, so if it's not there, then just a little bit of patience. And the other query was about VGD as opposed to PGD. Is it that it's just for that particular vaccine, or is it replacing PGD? Go on, sorry.
So there's no true information out there at the moment. Historically, COVID was given under the national protocol. That has now been completely retired, and the VGD has been put in its place. Based on the wording of the VGD compared to PGDs, it's likely that the VGD will also then stay around for seasonal flu going forwards. This is in light of the changes to consent, which haven't historically been a factor around these seasons. So we're expecting VGDs to become more prevalent and PGDs become less so. But this is NHS England. And as we know, nothing survives contact with the week after they make a decision.
Thank you very much. Hopefully that answers your question, but please just continue to fire your questions away if you do need support with anything more. Okay, so I'm going to actually show you how to refresh in Resource Publisher if you're struggling to see the resources. So someone with Resource Publisher access can only do this. So they will go to the EMIS bubble, down to configuration and hit Resource Publisher. So this is if you're unable to see some of these resources. When I say resources, I mean templates and protocols, nothing to do with reports at all. So normally what works is if one person goes into Resource Publisher and they hit the refresh button, which I'm not going to do now, hit the refresh button and then wait for it to refresh, and then hopefully that then updates everyone else. If you have refreshed and there are some staff members that still can't see the resources, get them to log out and log back in again, and normally that works as well. But like Chris mentioned, sometimes you do need to wait for overnight because we only made the changes this morning, so you might have to wait overnight and get that done in the morning. So if you're still stuck, then just let us know. It's just the refresh button there. So I'm now going to show you how you can edit the protocol. Now or protocols, because it's both for RSV and COVID as well. Only one person needs to do this in your practice, and that will then be available for everyone on their F12 key. So over on the left-hand side, I need to make sure I'm in Resource Publisher. So that's my first step. I'm going to show you how to do the COVID one, and then the RSV one will be very similar. You need to make sure you're in the protocols and templates area. And then once you're in this area here, you'll come down to shared folders. And this is where in here, you're going to find the Ardens content. That's really important. I'm going to get Chris to post the article on how you edit this so you've got some instructions. Once you're in the shared folders, you then want to be focusing on the Ardens folder. So for COVID-19, that one is in this folder here. So Ardens National Content New. Expand that, move down to vaccinations. And within vaccinations, if I just expand this, you've got the seasonal vaccinations COVID-19 protocol. So it's the one, this one would be active. It's the only one you'll see in your site. So it's this one that you need to take a copy of. So you are unable to edit directly an Ardens protocol. And this is just an EMIS thing, not an Ardens thing. So in order to edit the protocol, you have to take a local copy. So your next step is to right click and then copy. What you then want to do is go to a folder which is within your practice area. So you may want to actually create yourself a folder that says vaccinations with Ardens in brackets or something similar, so that you know that that's exactly where you're keeping your local copies. You would right click and then you would click the option for paste. And what that will then do is it will paste that in as a local copy. Now you can start editing that protocol without you copying. I know I sound like a broken record, I'm really sorry, but I'm just thinking of the support questions that come in. If you are not finding you can't edit it, it's because you haven't copied it first. So once you've copied it across, you may want to rename that just to make sure that it's clear that this is one that you have copied, or make sure you deactivate the Ardens one so there's no confusion of what ones your staff are picking up on their F12 key. That's another really important step. To edit, I right click, protocol, and then I've got the option for edit. And what that will then do is it will take me behind scenes into the protocol builder screen, which always looks like the London Underground when I have a look at it. It's really quite confusing, but I'm going to show you exactly where you need to edit the information that you need. So if you remember back to that protocol, when I run it using the F12, remember it launched a consultation first, which is correct, and then it answered me this multiple choice question on whether or not the patient was consent and they and fit to do it, etc. So this is what this box is here. What you're having to update is the ones that link to these boxes. So anything that says add coded data on this level here is where you will be. No, sorry, I'm wrong there. Just move that down, across. James, which one are they editing, or am I going mad?
If you keep going across, you'll then find the big pile of stuff.
I'm one step ahead. Okay, cool. So I'm here. Move across and down. Please do not worry. We've got instructions on how to do this. What you're looking for is everything with the multiple choice questions. So these are all of your different vaccination types. And it's these boxes here that you want to be editing. So I double click and so I go back again. So I look to see where my left arm is, my right arm is. So it's all of these here. And these are the boxes that I need to be editing to add my batch numbers, etc. So I first of all double click this box here, and this is where I can change the label so that when they click left arm, right arm, they know exactly which batch number they need to be clicking on. So I'm going to click the very first one and I'm going to click on edit. And then here I'm going to change the batch number. Not going to save this, don't worry, James, I can hear you panicking there. And I'm going to pop the expiry date in as well. So I'll pop that information in and I'm going to then click on OK. Once I've completed that, so this is just the label, I then need to make sure I also edit as well the box that's associated to it. So if I click on the link, it will tell me where this box is. I can double click on the box, and here is where I click on add qualifier, and this is where I would complete the manufacturer details, the expiry date, the batch number, GMS and injection site. So here I would put the manufacturer in. I'm going to do this again so it makes sense. The expiry date I would pop in. I would also put the batch number in. This is really important because otherwise this is not going to record it against the procedure code that you've added. And then you've got GMS. I'm going to say GMS. And I've also got the injection site is already in there. So I have to make sure, and then I OK it. So I have to make sure that I'm doing that to every box that I've amended here on the left-hand side. So every option, every box that's linked to it, I need to make sure that I edit the details. Once I've completed that all, I then save and close. And it's as easy as that. But I'm going to show you that again, just to make sure that we're all good. I'm going to start back from the beginning again. So my first step is, if I want to edit the COVID protocol, the same as editing the RSV protocol, one person has to go into Resource Publisher. So configuration and then Resource Publisher. Once they're in Resource Publisher, they click on Shared Folders. Once they're in Shared Folders, they click on Ardens National Content New. Within this folder, they would go down to vaccinations, and within the vaccinations folder, they would click on seasonal vaccinations COVID-19. The first thing that they need to do is they need to take a local copy. They right click and they select the option for copy. They would then paste that protocol into a folder outside of this, so into a practice folder, and rename it to make it clear that that is the local copy that they've taken. And then they'll let their staff know that this is the one that they need to add to their F12 key. When it's time to edit that copied protocol, I right click, protocol, and then go to the option for edit. This then opens up the protocol builder screen for me. The very first thing that I need to do is move across to the right-hand side, because it's these multiple choice question box are the ones that I need to be amending. I've got one for each vaccination type, so I need to do this same process for each box and each vaccination type that I'm doing within my practice. The first thing that I need to do is update the multiple choice question box. So I double click, and for each batch number I need to add to my F12, I select the option, I click on edit, and I replace the batch number and the expiry date. All that is doing is just replacing the multiple choice question. Once I've completed that information and I okayed it, the next important step is to then update the boxes that are associated with it. So if I click the actual link, that will tell me exactly which box I need to be updating. So I'd navigate to that box, double click, and then from here, I would start using my add qualifier. So it's already put the left arm in for me. I'm going to add qualifier, go to manufacturer. I'm going to put in the manufacturer details. I'm also going to put in the expiry date using the calendar. I'm also going to put in the batch number as well. And whether it's up to you whether or not you also include GMS, and I'm going to say GMS in there because it's being delivered in my practice. I then click on OK. And what I would do is I would do that for every single box that I'm using that is linked to that multiple choice question, not just for the first box, also any vaccination, COVID vaccination type that I'm using, I would need to make sure that I do it for each of those boxes. I then go save and close, and that will then save it back to the system, and then anyone can then add that to their F12 key, and when they run the protocol, all of the batch numbers and expiry dates will be populated. I hope that makes sense. Please give me a thumbs up if you followed along. But what we will do is we will share the support article, which really lays it out for you. And we are also here. Thank you. There's some thumbs up there. But we're also here to also support you with this. So you can contact us, our support team, if you need any help with doing that. When it comes to RSV, it's exactly the same, but the protocol is in another place. So when you're in the in Resource Publisher, you need to and you click on the shared folder, you need to go to Ardens Live National Content. You then need to go down to Vaccination Protocols, and within Vaccination Protocols, you've got RSV. So this is your protocol here to amend. So exactly the same thing. You make a local copy first, then you edit that protocol and you update the coded boxes to ensure then that that information is captured. Any questions on that, James or Chris, or anything that you want to add to that little process there?
I think the key one is coming off everyone is COVID has changed this year. So previously there was a load of pre-screening questionnaires you had to do when you're using a point of care system. Now this has moved into a GP DES contract and into the clinical systems. It's very much the same as flu. So there is less screening questionnaires that need to be done beforehand. However, as with any medication issuing or vaccination, part of the consent is looking at past history of allergies and all of that elements that would be included in step 1 of the VGD by whichever practitioner signed that.
Okay, cool. Thank you, James. Chris, anything
Charmaine,
more to add? Yeah.
just one other thing. Just reminding people to activate the protocol if they edit it. Well, once they've edited it. I'm sure you said that. Sorry, but just we've had a few questions.
No, that's fine. So it's just the case of a right click, and then you can then activate that protocol. Mine's already activated, or you can use your options up the top there. So you've got the activate button there. So that's a really important step. Otherwise, they won't be able to add it to their F12. Thank you, Chris. That is everything that I had to show you today. So I am just going to quickly now just take you to the last parts of the slides. Remember, we're going to share all of these presentation slides so that you've got that. Actually, before I show you the last slide, I am going to just quickly bring up Ardens Manager. Ardens Manager is our population health management tool. You need to be signed up for it in order to use it. So it's separate to what I've shown you here. Hopefully a lot of you are already Ardens Manager customers, but I just want to remind you, if you are an Ardens Manager customer, you also got the vaccination dashboards that you can be using to monitor your activity at practice, PCN, and also ICB level. So when you log into Ardens Manager using your smart card, and just bear with me while I just log into Ardens Manager again. In. So I'm logging in with my smart card. I'm doing that so I'm able to access patient information, and it's just a much more secure way of logging into the platform. Apologies, bear with me. It might actually go a bit slow now. Okay. Okay, so once I'm in Ardens Manager, I just click on the services page on the left-hand side and then down to vaccinations. And then we have a whole vaccination dashboard to help you with all of the different vaccinations. So here is your COVID-19. So that will give me a top level view of how many vaccinations have been done in my organisation, but also across PCN and ICB as well, which is really handy. I can also see how many invitations I sent, and also looking at my performance too. So understanding my risk groups and understanding patients who have had more than one COVID vaccination. So if I wanted to target patients in any way, I can do that. I've also got the option to be able to view the reports further, and what that does is it allows me to compare my progress against my neighbouring practices if I've got the rights to be able to do that. And it also allows me to look at my demographics too, which is really good. So I could just say, look, rather than show me what I've achieved, just show me what's remaining. And then I can have a look at my demographics and see the age population or gender or ethnicity or deprivation who may not be coming in for their vaccinations, just to give you more greater insight. I can also click on the patients tab, and that will tell me my patients that are still remaining. And then from here, I can export that list out if I want to. I've also got the view option, which allows me to go into that individual patient, and it will show me not only the report that I'm currently looking at, but all of the different reports that that patient is appearing in. So this is really good to make sure that you're gathering all the work that needs to be done for that patient. And that's something new that we've only just released not so long ago. So something you may not be aware of, which might be handy. And we can post some support articles in the chat for you. So this really is here if you do want to monitor your performance. We've also got the RSV tab there as well, again, which will give you an indication of how you're doing, not just at practice level, but also at the group levels as well, if needed. So we'll post a link on Ardens Manager and more information. If you're not using it, you can sign up for a 1-month trial too, so that might be worth doing. So we'll pop some details on how you can sign up for it if you feel it's going to be useful for you. So really, that then brings me to the end. So I'm just going to go on to my last slides now and talk about training and support. So we have lots of training and support available for you, not just in this area, but all of the different Ardens resources that are available for you. So we've got the support articles that we've been posting in the chat. If you want to book onto any training for your team, then please contact training@ardens.org.uk. We're more than happy to put a training session on for you. And you can also contact our support team if you have any further questions, and you can contact them at support@ardens.org.uk. We will be emailing out all of these details for you, and I will get the guides to pop in the details in the Q&A for you as well. And that just leads me to the very last slide, which is feedback. We always welcome feedback on how you felt the webinar went, but more importantly, how you're finding the resources. If you feel that there's any improvements that need to be made, or if there's anything you find that is really helpful, then do let us know. You can just scan that QR code. That will take you to a quick survey that you can complete. And that really brings me to the end. So I'll leave that slide up. Chris, James, any last minute questions that we want to talk about before we close the webinar?
The key one is Optum are in control of all the qualifiers that will sit behind the administration code. We are expecting there to be location options to allow them to practice to record the ODS code of care homes, and that comes out as a number of other data points that NHS England has stipulated need to be captured. Because these are qualifiers to the code, as soon as Optum release those, they'll appear whenever that code is added, be that through a normal consultation or through our protocol. So it's just a case of waiting for that knowledge base update from Optum.
Amazing. Thank you, James. Anything for you, Chris?
Sorry. Just the last one. Will eligibility criteria be made live for COVID-19 in the pink alert box? I can't remember whether that's something we normally do or not.
Optum. Isn't that an Optum?
Is that an Optum one? Yeah.
Historically, it has been. I'll get the team to look at the feasibility of that this week. We'll just check that we are able to do it with the concepts that are required and make sure we're not going to cause a conflict with Optum.
Okay.
Perfect.
Someone's just posted there, where can we find what codes that we exactly need for COVID? So the support articles will show you the invite codes, and just use the protocol in the template for the procedure codes. That's your best bet. Then you know you're definitely using the right coding. Hopefully that answers that. Brilliant. Well, thank you very much for your time. Next webinars we're doing now is end of April, where we're going to be looking at GP contracts. So if you want to sign up to how we're supporting you with your QoF and your network contract DARES, I'll get the guys to post our upcoming webinars page on the Q&A. So please come along for that. We're also doing one around continuity of care, and we're doing loads of webinars around LTC. So do make sure you save that page and sign up to as many webinars as you can. Thank you so much, everyone, for attending. We'll leave it there, and we will see you on the next one. So bye for now.